Dr. Rachana Kulkarni, welcome again to ITV Gold. Thank you so much for giving us your time today.
Of course, Aditi. Always a pleasure to be here. Thank you.
Of course, we have to have you because there's so much happening in coronavirus and we have to update our audience and we have to make the awareness go all over. So let's go right into it, Doctor. There are some numbers coming in today that I'd like to discuss. We're looking at 27.8 million cases of coronavirus in this country with at least 488,000 deaths. We are approaching a milestone, a very grim milestone of 500,000 deaths in the nation. We are hearing that currently the cases and deaths are going down. The trend is going down. I'd like to know if that's actually happening because the numbers that are coming in are massive.
There is a silver lining to this cloud, Aditi, the dark cloud that has engulfed us in this entire last year. The cases, although the actual number is very large, the cases have started coming down. In addition, even if we have infections, not so many patients are succumbing to the illness, dying, because now we do have treatment options available. So that's encouraging. So total number of cases are coming down, the deaths and hospitalizations are coming down, and we finally know that the medications that we have, the treatment options that we have are working.
Right. So there is some positive news coming in here. I'd like to now know, experts are currently worried about a fourth surge due to the variants. How are you looking at it? How concerned are you about that? Are we going to see fluctuation in cases and deaths coming up?
It certainly looks that way because it's a virus, right? So virus is going to mutate. It's no different than mutation of a flu virus. So influenza virus mutates, and every year, wherever the flu season starts, the scientists try to study that and quickly adapt the vaccine to cover as much or as many mutations and as many strains of the flu virus in the flu shot as possible. I don't see any difference here, because the virus is going to mutate. New mutations are going to come out, and the scientists, and my salute to them, they will have to adapt to the new strains and change their vaccine composition accordingly.
Right. When you're looking at these variants, Dr. Kulkarni, can you give us some insight into the UK variant and the South African variant? South Africa as a country had to stop AstraZeneca vaccination due to the variant that's there, and the UK variant is spreading all across the United States. How are you looking at these two?
Those two variants certainly are concerning. And let's talk about the South Africa variant first. As you know, you just alluded to, that the AstraZeneca vaccine, which was about to be rolled out by South Africa, they had to pull it back because that vaccine showed to have very little efficacy against this new strain. And now the J&J vaccine is being given. So, we know the shortcomings of AstraZeneca vaccine against that variant, so it won't be much effective. The UK variant, at this point, it seems like the majority, the big players here, the Pfizer and Moderna vaccine, looks like it is going to be effective against that virus. Having said that, the UK variant is a lot more contagious. So I would suggest to all your viewers and listeners that because of the contagiousness of this virus, let's make sure we continue to take the precautions of masking and social distancing if we could.
Yeah, that's so true. And before I ask you more questions on the vaccine, Doctor, I have to ask you this one question that we keep on hearing, that young adults aged 20 to 46 could be responsible for these surges of cases we're seeing in certain states, even though the cases are coming down nationally. What are your comments on that?
It certainly looks like that is the contributing factor because for sure that everyone is having COVID fatigue, and I don't blame that age group. They are having COVID fatigue as well with the holidays, with COVID fatigue. People are getting out, getting together, and all it takes is one person to be infected by COVID, and they could be completely asymptomatic, but they are going to spread it as a ripple effect, and we are seeing it time and again. So I do believe that that is contributing to the new surge.
Yeah, then it's even more important for them to be so vigilant, for all us to be vigilant right now. Doctor, let's go talking into about the vaccines real quick here. My first question to you has to be, have you personally seen any difference between side effects from Moderna and Pfizer? These are the two vaccines that we're seeing in the US right now. What have you seen? Are they similar in side effects, or is there some difference in it?
I'll share my personal experience and the experience that I have had personally. I received Pfizer vaccine, no issues other than some local irritation. What I'm seeing, and this is strictly observational, this is no clinical data, but it seems that more people are having side effects with the Moderna vaccine than the Pfizer vaccine. None of these side effects are anything serious, but we are seeing across the board more side effects with the Moderna than the Pfizer.
Oh, wow. That's interesting to know. You know, I also have more questions on the vaccine, doctor, here. Johnson & Johnson is coming up with a single-dose vaccine, but the efficacy of that is actually lower than the Moderna and Pfizer vaccine. How are you looking at the efficacy part of that in comparison to the other two vaccines? And could this still change the game of vaccine supply if it was approved?
It's certainly. So it's a two-part question, and I'll answer it in two parts. That yes, logistically, the Johnson & Johnson vaccine, which is single dose, is very appealing, because the challenge for vaccination sites is to make sure the second dose is scheduled for, people follow through. So logistically, the two-dose vaccine is a challenge. However, the vaccine is 95 to 98% efficacious, which is just amazing. Mm-hmm. It's as good as the gold standard, which is the measles vaccine. The J&J vaccine is at this point quoted as 66% efficacious, which is still great. And it will give us a lot of herd immunity. Let's not forget that the flu vaccine efficacy, which is across the board, that's what we do and we get, is in the same range. So it will definitely help us with the supply chain of the vaccine. It will also help us ease the vaccination process, logistical problems. So it certainly is an attractive option, although as not effective, certainly a very good option.
So is the protection a bit lower from COVID-19 in the J&J vaccine?
Yes, the efficacy is to protect from serious COVID infection is about a third less than the Moderna and Pfizer vaccine.
And how are you looking at AstraZeneca, doctor? It has been approved by the World Health Organization as of this week to be administered in poor countries across the world. But it hasn't been approved here in the United States. And as we spoke earlier, it has been stopped by South Africa. So how are you looking at that vaccine?
It's an option. It's a good option. But if we have better options, that's what we should go with. Unless AstraZeneca is able to modify the vaccine to be effective against the other strains, I think the other three vaccines appear to be a better option.
Doctor, what is your take on mixing doses of the Pfizer vaccine and the Moderna vaccine to just speed up the vaccination process? Can that work?
You always are better off, in my medical and scientific opinion, you're always better off sticking to the protocol and not mixing things, because let's not forget, a Pfizer vaccine is given, the second dose is delivered 3 weeks later. Moderna is 4 weeks later. Although the basic technology is the same, there is still some variation in the two vaccines. So if possible, my suggestion is sticking to the guidelines.
Right. I have more questions here for the vaccine doctor. How are you looking at the immunity after vaccine? We're hearing from experts that currently they're saying it can last up to 90 days. But what happens after the 90 days?
There is good scientific data that has come out saying the Pfizer and Moderna vaccine have at least a year of immunity. Could that change with the new variants? It could. But at this point, it looks good for beyond 90 days. May not be, the protection may not be as robust, may not be across all the variants, but it's certainly, at this point, the studies showed a year.
Wow. Another million-dollar question here that everybody's asking across the nation, doctor, if you have been vaccinated, given both the shots, what can you do? Can you not wear a mask? Is social distancing still, required? How are you looking at that?
There is so much about COVID that we don't know, Aditi. So we are better off being a bit more cautious. So even if we have vaccine, let's make sure that we don't congregate in big groups. Travel might ease up a little bit after people have had 2 vaccinations, but till we get a good handle on the new variants and the vaccine and the virus mutation, you're better off using the masks, social distancing, and sanitizing.
Right. And more on vaccine, doctor. Do you believe that domestic travel should require a vaccine when traveling?
It would be great if we could. It is going to be just so much safer. But at this point, we do have some supply-demand mismatch. There are so many people, and not just young adults. There are so many people who are vulnerable population, people with heart issues, people who are immunocompromised, people who are cancer patients. They are waiting to be vaccinated. So we do have those supply-demand issues. So if we can get the vaccination, that would be great. If not, a negative COVID test should be a good alternative with all the precautions.
Right. On vaccination, another big issue, doctor, is concerning schools nationwide and educators and teachers. The CDC has said that schools can open up safely without these educators being vaccinated. However, these educators and teachers are really scared about getting the COVID-19 virus. What is your advice to the government in this sense, and also your advice to these teachers?
In an ideal situation, everybody should be vaccinated. The kids are not going to be because they just don't have the data. The vaccine has not been studied in that age group. But in ideal world, all the teachers should be vaccinated. Whether or not it's practical, that is for the government to decide. And I understand and I see CDC's recommendation that at this point it's not required. In an ideal world, it should be.
Right. I just have 2 more questions left here for you, Dr. Kulkarni. When you're looking at the vaccine research right now and all of the vaccines that are available across the world right now, what is still missing in it? What is the missing component that scientists and doctors such as yourself are still trying to figure out?
There are 2 big missing components, and I think it will evolve as we have more and more time to study. Things will evolve. One is the vaccine is not yet tested in pregnant women and in young adults or children. And that is a very vulnerable population. So you want to make sure that the vaccine gets tested in that. So that's one big missing piece of the puzzle that we are missing. And the second is how will the vaccine protect against the new strains? So that will be an ongoing investigation. Those are the 2 big variants that we will yet to know about.
Yeah, and hopefully we can vaccinate children, because That would really help the entire education system. Dr. Kulkarni, my last question to you has to deal with at high-risk patients that are South Asians. We usually talk about it in every interview of ours. Have you seen recently cases of COVID-19 and cardiac issues or other comorbidities that could really impact a patient?
Yes, because South Asian patients are at high risk for having heart disease. And we know that COVID is diabetes and heart disease are two pre-existing conditions in which COVID could be a little more fulminant, and that puts the South Asian population at higher risk. Also, it's a very family-oriented demographic. So we like to get together, we like to socialize. That becomes part of who we are. And that does, especially during this time period, does increase the risk of COVID infection. So my suggestion to all your viewers would be, make sure you visit your doctors, make sure you manage all your conditions successfully, the diabetes, the heart disease, high blood pressure, because all of these pre-existing conditions will put you at high risk for COVID infection. Make sure you get your vaccine. And for now, love is staying apart.
Yeah, the social distancing and mask wearing so important. Thank you so much for your time again on ITV Gold, Dr. Kulkarni.
Always a pleasure, Aditi. Thank you for having me.